When I was meeting with a scientist up in New York earlier this week, and he said, I don't like that term. He's a neurosurgeon. And I said, well, it's stuck, but it generally means this list of symptoms. Some scientists have been trying to call it post-chemotherapy dysfunction or cognitive dysfunction, trying to disassociate chemotherapy from the cause. And so there's a lot of debate. There's a political debate about Chemo Brain because if it is in fact a legitimate side effect of chemotherapy, then its healing recovery needs to be covered by insurance. And so, but if it's just general stress, well then maybe we don't have to cover this. So also it presents opportunities for pharmaceutical companies and other companies to prescribe more medication. So you've got pro and con. I'm just telling you, I have no skin in the game. I just want to get at what's really happening. And there is a cause and effect. So what we mean by Chemo Brain is a symptom list, kind of regardless of what the cause is, and mental fog, and I will describe what that is as we get into some information about the brainwave. Memory deficit. Some people already have some memory deficits, but they do get worse. Slower processing speed. I've actually measured this myself. A friend of mine was diagnosed with breast cancer right after I was, and we began sharing my story. So she actually did a processing speed test in my office before and after chemo. And she had 400% slower processing speed after chemotherapy. And when she walked into my office, I said, how's it going? She said, well, I think I'm slowing down a little bit. And I didn't really even want to tell her how much she had slowed down after she took this one test. So it's definitely measurable.